and quantitative analysis of pharmaceutical excipient. Today I'm going to talk about magnesium stearate. And this video is a request by one of the viewers that asked me to prepare a slideshow about how to do the quantitation of magnesium stearate in solid dosage form. Magnesium stearate is mostly used in tablets, and its function is a lubricant. So what it does is that when the tablet is made by a tablet press machine, it will prevent the tablet from sticking to the metal component of the equipment. Now I can pour a little bit of this stuff on my hand, and the material is very fine powder, micronized even, it's extremely micronized, and has a very small particle size distribution, and when you touch it, it feels like you're touching a bar of soap. It is somehow greasy. I don't recommend you putting so much material on your hand. They are not toxic, but still you better avoid putting too much chemicals or expose yourself to too much chemicals. I'm definitely going to wash my hand. So I'm going to go back to my PC, and I will continue this video by showing you some slides. Talk to you soon.
Hello again. So I'm going to continue talking about the magnesium stearate and the qualitative and quantitative analysis of this excipient in pharmaceutical dosage form, especially the solid dosage form. So magnesium stearate is a salt of stearic acid with magnesium. So we have one magnesium ion with two stearic acid. So in this structure, we can assume that there are two stearic acids, but depending on the raw material used to make this excipient, I would say that you may have a stearic acid and palmitic acid mixture. So don't be surprised if you have the combination of these two. So the magnesium stearate does not necessarily guarantee that you will have just a stearic acid in there. So you may have some palmitic acid as well. Now, I'm showing you the comment by one of the viewer. I think the name is Jalanes, and the comment says that please put a video on quantification of lactose, microcrystalline cellulose, HPLC, magnesium stearate, and it seems like these are the list of inactive ingredients in one of the formulations that he's working on. So I kind of read the comment. I replied that yes, I will do some of them, and I'm going to do magnesium stearate only today, and probably I will do some other ones. The method that I'm going to talk about are GC and with USP 401, which goes on the fats and the oils. And the second one is HPLC ELST. My method of choice, I think I would say oven fried, is the GC method. So let me start by talking about the GC. Well, the USP 401 it has a good method on doing the fats and the fatty acids. And there are this chapter has a number of components, and one of them is to make the methyl ester of fatty acids. There is a table in this publication in a 401 monograph that it talks about the different type of fatty acid that you would expect to see, and there is a GC chromatography condition for this method. It uses the I think is a dB wax column with the dimension of 0.53 and 30 meter long and 1 micrometer the film thickness. I have used dB wax for this method, and I would say because for the magnesium stearate, for the purpose of magnesium stearate, any column will work. So it doesn't have to be like it dB wax. Even dB624 will work. We'll talk about it later. And there are conditions, there are oven condition in this method that you could probably use, and it will work, for sure it will. And also, if you are interested to do the peak IDs, there are standards. I think they are called 17A or 19A. They will have different fatty acids and methyl ester of the fatty acid with different compositions. So you could buy these peak ID standards and do the peak ID if you wish. So to make the magnesium stearate, you need to first of all make the methyl ester of magnesium stearate. And there are two phases in the sample preparation. First, you have to use sodium hydroxide dissolved in methanol, and so you reflux it. And after that, you will go the second reflux by adding this reagent, which is 4 grams or 14% boron trifluoride in methanol. The USP talks about refluxing all these steps, and I would say that you can skip some of them. You don't have to reflux for certain hours. It's just up to you. I mean, I definitely didn't reflux none of my solutions. I only heat them up to 80 degree or 90 degree, or like the boiling point of methanol definitely is less than 80 degree. And also there is a section or steps that you have to pass through this sodium sulfate. So in order to dry it, I always skip that, and I didn't see it necessary. So you could use this method for your sample prep, and after converting the magnesium stearate into methyl ester of magnesium stearate, then you can use the GC method that I showed you in previous slide and get your peak quantitated. And there is another method, the HPLC ELSC. It is published by Agilent, and definitely we can see you can use this method for sure. You can use the conditions are here on this slide, and we see 7 peaks of different fatty acids, and peak 6 and 7 are palmitic and stearic acid. So I will suggest that you will dissolve your magnesium stearate in some sort of acidic solution, in some sort of mobile phase with acetic acid, and to convert the stearate to stearic acid, and then you do the quantitation. Now, as I said before, that your magnesium stearate, maybe you will end up seeing some palmitic acid, so don't be surprised if you see peak 6 in your sample, or maybe like even I would predict some of the material you may even see 50-50 palmitic versus stearic, or some of them maybe 10-90, or some of them a lot less palmitic. So don't be surprised. So this is a very good method, and it doesn't need any methylation. It is very straightforward. Once again, I'm showing the comment by Jalani, and for your purpose of magnesium, like doing the magnesium stearate, the two methods that I showed you, you have to keep in mind that the other excipient in the formulation may interfere. In the case of GC, I would say none of your excipient that you listed will interfere with quantitation of magnesium stearate, so the GC is very good. But in case of ELST, you may have some maybe lactose interference, maybe lactose interference. These smaller molecules may interfere. So the choice of a column, maybe the Agilent column maybe is not suitable for you. You use another column to retain the magnesium stearate a little longer, and I would say the separation would be rather straightforward, and I don't see much of an issue with this the quantitation even using ELST. Use a proper sample solvent that you end up filtering out the HPMCs, the cellulose and stuff, that you will have less of interference. This slide shows the FDA IID database for magnesium stearate. I will say there is a large, many entries for magnesium stearate. Like in the case of oral, there are 34 entries, and so I'm not going to go through them. And once again, the formulation that you are going to reverse engineer, you need to go through these tables, or you have to go to IID database, and you have to have a good understanding of your maximum potency. So this is very valuable information. The references are definitely USP chapter 401. There's a supplier's website, which is one of them was Agilent, and maybe there are many other publication on magnesium stearate. I only talk about two of them, and the first one was my favorite, GC method that I always use, and ELC is kind of handy and this is quite nice. Thank you very much, and if you like this video, please press the like button, and if you have any experience with magnesium stearate that you'd like to share with us, I really appreciate you write a comment, and I will definitely get back to you. Thank you very much, and have a good time. Bye.